نام عبدالسلیم هستم. توفیق برادرم 32 ساله است. از افغانستان آمده.
His name is Abdul Salim. The patient Tawfiq is his brother, and he came from Afghanistan for treatment. And Tawfiq is 32 years old, and it's former in Afghanistan.
توفیق ما برادرم 32 ساله است. و این 10 سال وقتی پیدا شد خوب بود و از 10 سالگی از 10 سالگی 32 سال شد. عمرش از درد داشت، گریان میکرد، خواب نداشت. حالا اینجا مشکل داشت پای از این کج بود، پایش مشکل داشت و گریان میکرد، درد داره پایش. حالا بسیار وضع وزگه. حالا
When the Tawfiq was born at the age of 10 years, he was normal. After then, he finds some problems in his leg and back. He can't sleep, he can't walk, and he had pain, and every time he was crying.
22 سال شد این مشکل داره توفیق. در افغانستان تداوی کردیم، چند بار عملیات کردیم، نشد. باز از طریق وبسایت شفاخانه اتھایو هسپتال کولاپور هندیه آورده میشه.
From 22 years he facing this problem. We try many times to treat in Afghanistan, but it has no result. So we find the Athaayu multi hospital Kolhapur from website, and we inform that the Athaayu hospital is a good hospital for such as problems. So we bring him to Athaayu hospital India.
اینجا دکتر گفت که 2 عملیات میشه اینجا. یکی سبجیش عملیات میشه، یکی زانویش. و سبجیش موفقانه عملیات سپری شده و سبجیش هم بعدا عملیات میکنیم.
The doctor says in this hospital is 2 procedures, one hip joint replacement and other is knee. So the hip joint replacement is successfully done, and the knee will be done after 2-3 months.
عملیاتش شد، حالا خوب است، نانم میخوره، خواب میکنه، هوا میخوره، بسیار آرام است، دردش گم شده، بسیار راحت آرام است، حال خوش است، دیگه حال خوب است.
The operation is done successfully. Now he can sleep, eat, and he is so happy, and now he is so fine.
مریض خوش است، مریض ما و نرسینگای بسیار لایق و خوب هستند، بسیار خدمت میکنند، دکترش بسیار خوب است، بسیار کشف موادات کردیم، بسیار یک محیط خوب داره، دیگه مریض ما خوب است.
The patient is happy and fine. It has good services, doctors, nurses are so good, and the environment of this hospital is very comfortable for us.
و ما بسیار خوش هستیم، ما هم تو خوب شدیم و آرزو داریم که ما هم تو خوب شدیم و دیگه مریضام هم تو بیان. توقع ما همی است که دیگه مریضام خوب شه، بره بخیر و شفاخانهشان نام بکشه.
Like how they treat our patient, we like to treat all patient and get to good name in the hospital industry, and we wish good luck in this hospital.
Mr. Tawfiq Skandar, who has come all the way from Kabul, Afghanistan, who is suffering from a dysplastic hip with dislocation of the right hip joint for more than 22 years. He is now 32 years old. So you can imagine, since at the age of 10 years, he was suffering from this dislocation of the hip, which has been lying down quite higher, because of which he has developed contractures in the knee joint, hip joint, and compensatory spine, which has gone in flexion. So this young chap is bedridden with multiple contracture, unable to sleep because of the pain, has come for the treatment of his hip joint. In Athaayu hospital, which is a super specialty center in Kolhapur, has provided all the infrastructure which is required for the this man-month surgery, which requires a lot of procedures. So before going for the surgery, there is a big task in front of medical management, as he is suffering from hepatitis B positive, as well as he is having ejection factor which is just 40%. So bedridden patient at the age of 32 with medical problems which involves heart, which is having some blood problem, which is risky to the surgeon as well as to the assistants and technicians inside the operation theatre. So we have to make this patient fit absolutely for the surgery, number one. And after making all the necessity investigations and requirements, we have taken this patient for the surgery, which has lasted for more than 8 hours. And that surgery itself is a very complicated surgery, because getting back the hip to a normal level, which is dislocated for more than 20 years, is a very difficult task, because bringing hip down is comparatively difficult. There is no bone stock, so we have to do osteotomy of the femur. We have to reconstruct the acetabulum by putting the bone graft and putting the screws. We have to do the find out exact true acetabulum, reduce the hip, shorten the femur, and ultimately we are successful as a team to reconstruct his hip with uncemented hip replacement. And after doing this osteotomy, this patient is going to be a non-weight bearing for roughly around 6 weeks, and after that he will be allowed to walk. So considering his scenario and the condition of the patient, this is quite a successful surgery. It requires a lot of team efforts, which includes physician, cardiologist, anesthesiologist, very good competent operation theatre staff, as well as the nursing and ICU staff inside the hospital. And we have got a fantastic infrastructure which has been given by Athaayu Hospital. And I am thankful as a surgeon, because all the way coming from Mumbai and to operate in Kolhapur. So we are a little bit skeptical whether can we do this surgery, which is an institutional case. But fortunately, he has also cooperated very well, thanks to him. And now he is on the verge of going back to Afghanistan. And we wish all the best for him. Thank you very much.